My name is Sebastian Däröste. I am an Invisalign diamond provider and aesthetic dentist practicing in Oslo. My specialty is Invisalign treatments and aesthetic treatments such as veneers with composite or porcelain. I use my iTero scanner on basically every patient. It doesn't matter if it's a recall patient or someone coming in for an Invisalign consultation, or if it's a crown prep, or if there's a fracture. Maybe that fracture is due to something wrong with the bite that I can then show using the occlusogram. My experience with the iTero scanner has been great. The patients, they accept so much more treatment that I tried to tell them before. With the 5D Plus, I can communicate so much better because the screen is so big that it's very easy to show them from all angles things that might need to take care of, and also things that they might point out that don't need to be taken care of but can be kept under monitorization. This is where we can build a lot of confidence with the patients because they understand that we're not into selling them all the treatment but only what's necessary. The iTero scanner is so much more than just an Invisalign scanner. I use it for all my restorative work, and it replaces anything that you would typically do with an impression before. So you can use the iTero scanner for basically everything. It doesn't matter if it's crowns, bridges, implants, surgical guides, or night guards. Of course, you can use it for Invisalign, but you can also use it for very basic things such as recall appointments. If you have patients that have severe wear, you can track this with the time-lapse function and thus educate them and get better treatment acceptance. The occlusogram I use for especially patients that have deep bites, or if they have attrition or abfraction, or if they claim to have something wrong with their bite, then we can easily scan this and show them how they're biting, where their contacts are. And most people understand that red is typically not good, and then you can start the patient education from here and thus get higher treatment acceptance for the treatments that are actually best for the patients. I use the iTero for all my Invisalign treatments, and I cannot do without it nowadays. The main function that I use and that I always start with is the outcome simulator, where I can show the patient a before and after, and I can also display different options such as, okay, what about if we remove this tooth? How would it look then? They can show all the opportunities that they have without actually committing to something before knowing all their options. This makes the consent process so easy. The iTero scanner should be able to be used by everyone at the clinic. It is so much easier for you as a doctor when you walk into the treatment room that the scan and everything is already ready, so that you can just dive right into discussing the case plan with the patients. But I even let my patients play around with their scans to have them immerse more in their treatment. The iTero scanner improves the communications with my patients in so many ways, but one way that is so obvious is that the screen is so big, so whatever you're trying to show them is in high resolution and easy for them to see. My experience is that the patients are wowed when they first see the scan, and second, they start seeing all the treatment that might need to be done, some that doesn't need to be done that we can monitor. This makes it a communication tool that I really cannot be without.